beyond everything. Something ought to be done about a fella like that. My life has got to be like this. It's got to keep going on.
Welcome back to our last segment with Dr. Gale Burstein before we go on to the pharmacy student immunization, but welcome back to Western New York Tonight. I'm your host, Tammy Lee Demler, and those listening on 90.5 FM. Dr. Gale Burstein is kind enough to come over here to Niagara County. She's the Erie County Commissioner of Health, but we gladly broadcast throughout all of Western New York counties. So we were talking a little bit about shingles. We were talking a little bit about vaccination. Before we went to break, I mentioned that Barbara Walters had chickenpox, and she was very, very sick.
Yes, adults become very ill.
Yeah.
They can get, it's not just the rash, but I mean, they can, and then possible skin infection if you're scratching your very itchy chickenpox rash. But I mean, adults oftentimes they get super infection with pneumonia.
Yeah.
They can get infection in their brain, meningitis, encephalitis. It can be, infections in their eye. It can be very, very serious for adults. That's why it's so important that if you may not know if you had chickenpox as a child, you can go to your healthcare provider and get a titer drawn, and then everybody will know whether you have antibody protection to protect you against the varicella virus if you're exposed.
Now, if I'm an older person, I'm going to my primary care doctor, I'm 60 years old, I'm thinking I'm going to get a shingles shot, and I find out that I've never been exposed, would I then get the varicella, the actual chickenpox vaccine?
Right.
So I'm getting a vaccine either way.
Right.
But it'll be
Sorry.
it'll be directed based on my history and what my status is.
Right. But again, if you were a betting man, you would bet that if you were over age of 40 that you had been exposed.
Perfect.
I mean, again, not everybody, but the vast majority of people have been exposed.
I know that we started off the hour with rabies prevention because we're talking about, not necessarily just summertime tips, but certainly rabies probably is more obvious during the summer, although bats can probably fly all the period of time, right? I don't know bat science, but
right. I think they're kind of
dormant.
Yeah, in the winter time, and then they come out in the summer, and then they'll hang out say in people's attics, but then in the summer, in the past couple summers, it's been very, very hot, and so then they're kind of forced out and to find other places. So that's when they might come into the rest of your house or fly into your house to try to escape the heat outside. Yeah. So that's why it's really important you have to bat-proof your house.
Okay, and they would include chimneys and all that kind of thing.
Right. Put wire or mesh out. Make sure that make sure you have screens on your windows. Make sure there are no portals of entry for little rodents.
Little rodents.
I mean, they're also, in addition to bats, you have to think about some other rodents that could carry rabies that might be interested in checking out your house. So there are ways to deter rodents from being attracted to your house. Make sure that your garbage is covered. If you have outside, make sure you put your garbage in totes outside, not just bags, because it's we know that raccoons will just eat through the plastic in garbage bags. So it's really important to have your garbage protected in big totes that many times the cities or townships will provide totes to residents to put the garbage out. So it's really important that you use that. Make sure you don't have standing water out because the rodents might want to come in, like the raccoons, and drink some water. Even an empty bowl, they might think has food in it, and so you want to make sure that you don't have any of that lying around.
Keep that away. I stole all of your prevention tips here, so
Good.
I'm going to read them, and if you have anything else to say about them, please elaborate on them. You said just simply don't let your cats and dogs roam free. How
right.
Are they safer chained up? Give us a sense of.
Well, many times, people are living kind of, right on the border of a forest, and we know that we see wildlife all the time. Some people are talking about they wake up and there's a deer looking in their window, or they see raccoon or skunk outside. So if you let your animals roam outside, they're more likely to be exposed to that ideally, having, indoor pets, or else keeping them inside, your yard, where hopefully the rodents will be less likely to wander into.
Right, because even cats that you let out, you don't know where they've been or what they're doing when they're gone. You had said neutering your pet can reduce the tendency that they might roam. So that's a good point. I mean, everybody should be neutering their pets, right?
Right.
Don't feed or water your pets outside, because you said empty bowls will attract stray animals. I never even thought about that. Don't keep wild animals as pets ever. Do you think people, probably some people do that, like even a cute little kitty that's...
We have seen that. So it's, wild animals really need to be in the wild. It's not fair to them. And if you encounter a wild animal that wants to be petted, there is something wrong with that animal's brain. So stay away.
All right, good point. You said here, if an animal is acting strangely, you need to report it. Just seeing any kind of odd behavior. I know that there are foxes that have had rabies that have acted really strangely.
And if foxes or raccoons, I mean, those are really nocturnal animals, and so you shouldn't see them out during the day. And so if you see like a raccoon kind of wandering out in broad daylight in your yard, there is something wrong with that rodent's brain. So again, that is something to report to animal control, because they're probably a risk.
And they would agree that that's odd behavior too, hopefully, right? You had here what to do when your pet gets bitten by another animal. That's a good point, because oftentimes we're seeing animals just out there. What if the dog's been bitten? You don't know by what.
Right. Again, it's important that you take your pet to a vet to get evaluated, because there's a risk of rabies, and there's also a risk of, again, bacterial infection. So it's really important that your animal is evaluated by a veterinarian or some type of animal healthcare provider, and they can assess they need for a rabies vaccine and for other treatment. Probably they'll need a course of antibiotics.
Right. Now, if you're keeping up with all of your vaccination requirements for your pets, in that regard, though, they should have more protection than somebody who's let that fall through. So another reason to go to the clinic.
Right.
That will remind everybody about. Contact animal control, obviously, if it's a stray animal. If you're bitten by an animal, what do you do?
Well, again, you really need to be assessed by a healthcare provider immediately, because there's the risk of rabies, and there's, again, also a risk of bacterial infection to the wound. You need a tetanus shot, so you should really go to an urgent care center, emergency department to be evaluated.
Wash first, though, before you go,
wash
just to make
it
sure.
out as much as you can, because again, that would help to reduce the risk of any type of infection, rabies, bacterial infection. So you want to make sure you wash it out really thoroughly with soap and water. Keep it under there for 10 minutes, and then immediately go to an urgent care center, emergency department to have a full assessment.
You always recommend to contact your Department of Health. Yes, if you get bitten by an animal, that is a good thing to report. Or does the provider call you?
The provider will call.
I see. Okay, so they keep statistics, and that's how you get them, is if they think it's a rabies
it's actually part of New York State public health law that the provider is legally mandated to report that.
So I don't have to worry about that reporting.
So they won't have to go to public health jail.
Okay, very good. And then we talked a little bit about the fact that if people know they're not bitten by a bat, or that they should assume that they might be. So let's talk a little bit about the clinics that are happening. I was joking around about the owners of pets, but you have to bring your pet with your paperwork for this rabies clinic. Is it free?
Yes,
Perfect.
It is free.
Okay.
So it's just a great opportunity, because pet immunizations can be so expensive, and so this is a huge public health risk. We don't want cost to be a barrier for people to get their animals protected and to protect themselves and their families. So we're offering this free of charge to Erie County residents who otherwise don't have an opportunity to get their animals immunized for rabies.
Every 2 years.
Yep.
That's quite a frequent schedule. Tell us again what the dates are and the locations.
So the first is May 22nd, and that's at the American Legion on Amherst Street, next to the Wegmans, just west of Elmwood Avenue. And that's from 4 to 7 p.m. The second one is May 29th, and that's at the Erie Community College South Campus, and that's also from 4 to 7 p.m.
Close for everybody at some point, either of those two locations.
We are going to be offering more clinics definitely in the fall and September. We'll definitely have a few more clinics.
We'll have you on before then, so you can tell us when those are.
Just check our website or give us a call if you can't make these, or it's not convenient for you, and there will be a rabies clinic near you.
And no RSVP required. You just show up that day.
Just show up.
Are those Saturdays? I'm having a hard time.
No, they're during the week on the evenings. They're on Wednesday evenings.
I'll forgive everybody for missing Western New York tonight if they can get to those clinics. No, just
Well,
kidding.
you know
go ahead,
what?
enough
They
time.
can. No, it's fun. It ends at 7, so
Perfect.
they
Excellent.
can get back for to watch.
To
here.
watch. Fun in the sun. I know we have just a few minutes left, but I wanted to make sure we touched base with this. How can people stay safe this summer, you know, in terms of the sun, cooking out, doing all the fun things we love to do that carry some risk if you're not watching?
Sure. Well, first of all, sun. You want to make sure that you wear some type of suntan lotion, good high dose of SPF, something 50, 60. Just make sure that you are protected from sunburn and sun exposure. We're seeing, the incidence of skin cancer is increasing every year. So again, you want to protect yourself from, future risk of skin cancer. We're seeing a lot of melanomas, unfortunately.
Yeah.
Again, with heat and sun and water, like it's raining tonight, and those mozzies come out, and so people can get bitten by mosquitoes, and mosquitoes can carry viruses. I mean, we not only West Nile virus, but there are other type of viruses that can cause, say, aseptic meningitis, a form of meningitis that's not caused by bacteria. So, and other type of viral illnesses. So it's really important that we protect ourselves against mosquitoes. You want to use a good dose of mosquito repellent DEET. 20% DEET is really important. It's safe. I mean, you don't want to guzzle it, but just put it on your skin,
inhale it, yeah.
right? And even on your clothes, just to protect yourself against exposure from mosquitoes. Also, mosquitoes, they have prime time, or they have mosquito rush hour is at dawn and dusk. So you want to make sure that you stay inside, or at least in a screened area, and to try to also prevent mosquito bite exposure.
Perfect. We have more to say, but we're out of time. I know, okay. We'll have to wrap up. Yeah. So let's talk really quickly again, just your website again, and people, so that they know your telephone number so they can call you.
Right. It's www.erie.gov/health. And our phone number is 858-6976.
On your website, do you have the information about those clinics?
Yes, that is on our website,
Perfect.
and everything that I talked about today is on our website.
All right, thank you so much for coming in and sharing your expertise.
Thank you for inviting me.
Have a healthy, wonderful summer. We'll have you back before it's
too.
over to help us stay safe and healthy for fall and winter. Thank you for tuning in tonight on Western New York Tonight. We're going to come back in 15 minutes, though, for 15 minutes of an interview, actually, with my students. I forgot. So we're going to take a break now, and we'll come back, and you'll be gone, and they'll be on. So don't.
Mr. Gatsby, I'd like to know.
Exactly who are you, anyhow?
No time.
Can't you see who this guy is? With his house, his parties, and his fancy clothes. We were born different from you.
It's in our blood. Nothing that you do or dream up can ever change that.
Gatsby. He had a grand vision for his life since he was a boy.
I'm gonna fix things just the way they were before.
Just you.
And me.
No amount of fire could challenge the fairy tale he had stored up in his heart.
Will you still love me when I'm no longer young and beautiful?
Is all this made entirely from your own imagination?
When I got nothing,
But I had the uneasy feeling that he was guarding secrets.
I know you will.
I wish I'd done everything on earth with you. I don't want to go.
And don't.
Last green light in my eyes, and my love on my mind, and I'll sing from the beginning.
It had gone beyond her. It had gone beyond everything.
Over the love of you.
Something ought to be done about a fella like